This week's episode of the podcast is being brought to you by Healthy Women and Esperion Therapeutics. Welcome to the Great Girlfriends podcast, where we discuss life, love, laughter, and every single thing in between. I'm your host, Sybil Amuti. And I'm excited! Yes. I know what you're thinking. She's always excited, and for the most part I am. But this time is for a different reason. Doers and Disruptors is literally happening in about 2 weeks, and I am over the moon. Okay, I don't want to scream in your ear, but I do want to send you to get your ticket. Let me tell you something. The lineup is incredible. You want to get there. Go over to the greatgirlfriendsconference.com and just look at some of the speakers. And we are giving $1,000 away in a Pitch Perfect contest. Do you need $1,000 for your business? Could $1,000 really move the needle on something you're working on? I mean, $1,000 in my business could really help offset some costs. So I don't know about you, but if you need $1,000 cash infusion into your business, I'm encouraging you, register for the conference and apply for the Pitch Perfect contest. It's a perfect, no pun intended, opportunity for you to get a little bit of a cash infusion to help offset some of your business costs or move the needle on an idea that you've been working on. So I'm encouraging you to do that. All right, enough about the conference. Enjoy this week's episode. Great girlfriends, I am back with another episode being brought to you by my amazing partners at Healthy Women and Esperion Therapeutics. Woo! This week, we're getting all in your health and your wealth, the wealth of your body. And we're going to talk a little bit about high cholesterol, which is very, very commonly found, or is so rumored to be found in the African American community and amongst our women. So great girlfriends, I'm really, truly excited to bring to you a doctor who is well versed in this topic, who can really give us some data, some myths, some truths, and some things to look out for in terms of our habits. And that is Dr. Ofili. Hi, Dr. Ofili. How are you?
I'm doing well. Thank you so much, Sybil. Thanks for having me.
It is such a pleasure. Let me tell you, we have these conversations in back rooms, right? And we hear about friends who are dealing with high cholesterol and having issues and with food and habits around food and, health. And so it's really important that we start to bring the expert voice to the table so we can clarify some of the things that are truly, truly important. And I believe that our bodies, that our wealth is really found in our bodies and our health. And so having you here is a reward for all of us. So thank you for being here.
Thank you. Glad to be here.
I'm so glad. Would you mind, we opted out of doing a long bio. Would you mind just sharing with us who you are and what your work has been about?
Sure, absolutely. So as you say, my name is Elizabeth Ofili. I am a cardiologist. I'm based here in Atlanta, Georgia. I serve as a professor of medicine at Morehouse School of Medicine, and I see patients through our Morehouse healthcare practice here in Atlanta. I also have additional roles that I think are relevant to this podcast. So I am the current chairman of the board, or chairperson of the board, I should say, of the Association of Black Cardiologists. And some of you may not know this, but the ABC, as we call it, is very much focused on the health of African Americans, particularly cardiovascular health. And I am privileged to work with lots of other committed members of the ABC, trying to bring information, practical information to our community to help them better take care of themselves and their hearts and their families' hearts. And then finally, I have a work that I do through my technology startup that works with Health 360X. It's something that people can download. It actually helps you manage your health, track your health, particularly cardiovascular health, like blood pressure, blood glucose, cholesterol, physical activity. So those are all things that I feel like I'm bringing to this discussion today.
Well, that's quite a wealth of knowledge and value. Thank you so much. We really, truly appreciate it.
I want to jump right in because, right now, Dr. Ofili, we're still, in the middle of a pandemic and,
Mhm.
everyone's talking about their COVID-19, right? So there's that
Mhm.
little bit of weight that we've put on, and there's also these habits that we may have picked up in our eating. And so a lot of people are, dealing with their health issues privately, but also picking up new habits that could really challenge their cholesterol levels, et cetera. So tell
Mhm.
me what we need to know about our
Mhm.
cholesterol.
So the first thing, again, thank you, Sybil. I really appreciate this, talking with folks and hopefully helping individuals understand what's possible even amongst ourselves and what we do, but also obviously in collaboration with our respective healthcare providers. So to
Mm-hmm.
begin with, cholesterol is actually something very natural, as many people know. It's in many foods out there. It occurs in our bodies. Even if we were to stop eating, the cholesterol will still have a certain number. So there is a natural function that cholesterol does. It actually has significant work with the proper working of the brain.
Mm.
And so when we talk about high cholesterol, good cholesterol, bad cholesterol, triglycerides, LDL, which is the bad cholesterol, HDL, which is the good cholesterol, these are all things that we need to think about because they all mean different things.
Mm-hmm.
So overall, what we call the total cholesterol, which is all of these numbers combined, that your physician will give you that information if you get a blood test. Normally, people want to be less than 200 of that total number, but in reality, the lower the better. So if you have a 150 or 160, that's good. If you're a little bit over that 200 number, as long as you're not up to 240, 250,
Mm-hmm.
200, 210, 220, you can still do stuff on a day-to-day basis without medication. And one of the things that we've learned is, if you modulate the kinds of diet that you consume, obviously meat tends to be the highest producer or the highest content of cholesterol, especially red meat.
Mm-hmm.
But all types of meat have higher cholesterol. Certainly organ meats.
Mm.
I'm one of those guilty folks. I just have to tell myself you can't just, be liking those livers or those, the organ meats. It's just no
Yeah.
matter how wonderful they taste, the
Uh-huh.
cholesterol levels are pretty high. So the diet piece, I think, is one. But also, what happens, interestingly, is when we're physically active, when our stress level is under control, that also affects what's going on with our cholesterol.
Mm. So if we were to reverse engineer or
Mhm.
even take a reverse glimpse rather into how we know our cholesterol level is too high, what would we feel like? What would we look like? What would be some of the differentiators for us?
So it's very interesting because you ask a very important question. And it is not unlike what we notice with other kinds of what we're calling risk factors for heart
Mm-hmm.
problems. These risk factors are really very silent. In other words, you're not going to have any symptom just because you have high cholesterol.
Mm.
Um, the only way I mean, you get a hint, as you say, the COVID weight, as your weight begins to go up, the cholesterol levels begin to go up. But knowing the actual number of the cholesterol will require you to have a blood test. Most of the time, we want that blood test to be fasting. In other words, nothing after midnight,
Mm-hmm.
because you don't really want any minor changes from the meal you just ate. We're more looking at what's been going on over the last few weeks to months. And when you get that blood test, it'll give you that breakdown, the total number, the LDL, which is the bad one, the HDL, the good one, and your triglycerides. Um, if you have diabetes, we interpret that slightly differently because diabetes will affect all of those numbers as well. So, what
Mm-hmm.
I say, Sybil, is rather than say, I will have some way to know when my cholesterol is high. Just have it as part of your health plan that you will check your cholesterol once every year, starting actually
Mm.
from everybody who's 18 and everybody who's an adult needs to
Wow.
know yeah. And
Yeah.
then if you have a family history of people having a stroke or a heart attack at a young age, and for us, that's something like anybody under the age of 60, that means you may have some predisposition. And so that you may want to know those numbers even earlier. But the general rule is 18 and older. You should know your cholesterol level. And then after you have that number, maybe not as frequently checked, but most people, when they're definitely in their 30s and 40s, we expect them as part of their annual physical checkup to have a cholesterol level done.
Ah, okay.
Yep.
You know what's interesting about that, I have to tell you, is I don't think that people put it on their radar until there's something wrong, right? So
Yeah.
we tend to wait until we need something or something's wrong, and we feel like you said. I mean, I'm hearing you say symptomatically, which by the time a person has experienced a stroke, or you've seen it in your family history, there are some habits that you've picked up as far as food, or even probably some even weight loss or health habits that you may have picked up along the way that I don't know, maybe not necessarily so beneficial. Is that true, or is that one of
That
those
is
myths?
true. No,
It
that is
is true.
absolutely true. And I don't mean to scare people, but the reason we worry about cholesterol is because when it starts going up, something else happens. It starts accumulating inside of the blood vessels.
Mm-hmm.
And that is what leads to a heart attack or a stroke. And so many, many years ago, somebody went and did some studies in New Orleans looking at young people teenagers who had some kind of, who didn't have a good outcome. So they
Mm-hmm.
died for any number of reasons. And they studied their blood vessels and found, lo and behold, even teenagers were starting to have buildup of these what we call plaques inside their arteries. And when it builds up to a certain level, usually as people get older, that's when they develop the symptom of a heart attack. One
Wow.
of the reasons it's important to understand this is that you don't want to wait, and which is again the other signal, you don't want to wait until you have that bad outcome.
Mm-hmm.
Once somebody tells you, okay, your weight is higher than it should be, or oh my goodness, we checked your blood pressure the last time and it's higher than it ought to be. These things, or you have a family history of diabetes and therefore somebody's telling you you're now going to pre-diabetes. Those combinations mean your cholesterol needs to be even lower than everybody else's.
Wow.
So
Yeah.
that immediately triggers, taking care of yourself. Because many people I know, many of my patients, I want to try to do this without medication if I can. And I think that's where some of what you're working on today, Sybil, and getting this information to people. Because it is possible to keep it under a good range with diet, with physical activity, with monitoring just what happens to our overall weight.
Mm-hmm. Now, when you start to talk about who's predisposed to high cholesterol, can you give us a little glimpse into what that avatar looks like? Who is that person?
Sure. So, first of all of us as we get older
Mm-hmm.
will have we will have increasing levels of cholesterol.
And why is that?
So some of it has to do with just how the body processes cholesterol, but some of it has to do with what happens with women. For example, with the menopause, there's some changes that happen. Some of it has to also do with the habits we pick up and how
Mm-hmm.
those habits begin to take a toll because we're less active as we get older. Right.
Yes, this is true.
Right.
Uh-huh. This
And
is
then
very
our
true.
dietary pattern changes. We settle into whatever it is we really like. And generally, most people are not getting better with their diet as they get older. But
Mm-hmm.
just the process of aging, the vessels get a lot more sensitive. The way we clear cholesterol is less efficient. And so those things is sort of all connive to keep us at a higher risk as we get older. But having said that, there are many people who are older who don't necessarily have high cholesterol where they have to take medication. Some of it, again, has to do with there's some programming that happens with your own family history. One of the things we've been hearing, for example, from COVID, and African Americans are more affected, and there's the comorbid conditions. And unfortunately, we know now that there's a lot that's associated with being a Black person in the United States, some of which is just the sheer stress of getting up every day and just walking out the door.
Yes.
Whether it's your sense of, anxiety about who's going to blame you for something, or feeling that nobody's going to pay attention to what you're presenting, all of those constructs that bring together race and racism have a lot to do with how our body feels and reacts to stress. That manifests itself with the blood pressure, with the obesity, overweight, which in turn, both things also lead to worse problems with our cholesterol.
Wow.
Yeah, so it's amazing how when people sort of rattle off comorbidities, people are not thinking that the same root cause is driving multiple things, especially when it comes to cardiovascular disease.
I've never heard the correlation, and that was so beautifully stated. That's almost the stress of life itself.
Yep.
Can create the onset of symptoms. And I don't think I've ever correlated the two. I think that's a beautiful reminder to us to even lift the stressors as best as possible, because we don't get to pick the consequence, right? We don't get to say,
exactly.
Move this stress and have this effect, or it just shows up in our body, and we don't get to see the long-term effect of it. So what we may not see today, eventually the toll of carrying the weight of certain stressors over time, we'll see later in life.
Definitely.
Yeah.
Definitely.
Jeez, it's tough. It's so tough. This adulting is complicated, especially when it comes to health. Because what we've got to look out for, this revelation came to me, Dr. Ofili, probably at 35, that I wouldn't get a new body, that my 75-year-old body was the one that I was, feeding and nurturing at that age. And I said, oh my gosh, I have got to treat her. I've got to treat her better, because I want her to be happy.
Yep.
I want her to have a chance, you know?
Yep. And it's amazing though, just like you just said, it's like, okay, which one am I going to pick? Because sometimes my patients will tell me, okay, which one should I not do? I said, well, it's almost like you want to ask, which part of my body do I not want to follow me? Because if your blood vessels have an issue, it's your eyes, it's with diabetes going on, it's also your limbs, It's all of it. It's your brain, how your brain functions.
Yeah.
So just say to yourself, I want healthy blood vessels, period. And once you say that, then the other things would follow. But like you say, some of it, there's none of it that does not require work. It's just we decide how we structure that work. Some people, it's easy for them to go for walks, figure out a time in their day. Some people structure some meditation into their daily work. So for some people, it's prayer. It's going to be different things, but find out how your body responds and then stay with it.
Yeah. Don't go away. We'll be right back after these quick messages. Hey, great girlfriends. It's Sybil here, and it's that time of year again. Thought our annual Doers and Disruptors experience was canceled? Think twice. October 2nd through 4th, we'll be back better than ever. We've partnered with The Colored Girl to bring all of the epic speakers, workshops, and networking online this year. Not only will you get all the feels that the conference brings every single year, you'll also receive digital bonuses and power-packed giveaways to supercharge your life, your business, and your career. Also, don't forget that Essence Magazine named our conference as one of the top 10 conferences that Black women need to attend to level up in 2019. Are you ready to register? Get your ticket while they last at thegreatgirlfriendsconference.com. I will see you there. And now let's get back to the episode. So, are there any secrets? Are there any secrets to any secret activities that'll help us, Dr. Ofili, to help to keep us on the right track? Which ones are the better of the ones to do and to not to do? Where would you put on the list?
I would actually put very high on the list walking.
Mm-hmm.
It's just such a simple thing. And, like some people have told me with this COVID, so we've got like a double whammy, right? We're all got all this schedule and we're sitting in front of our computer. But also some people have realized, you know what? I don't necessarily have to start my Zoom calls before 9, because normally I would be commuting to work if I'm privileged enough to have, the opportunity to work from home.
Mm-hmm.
But why not structure a 30-minute walk? And believe me, Sybil, the data is so strong, and it doesn't matter whether the work was done here in the United States or in the Netherlands or in South America. If you walk 150 minutes a week, so that's roughly 30 minutes a day for like 5 days, right?
Mm-hmm.
You would like cut in half your risk of becoming a diabetic.
Wow.
Yeah.
Wow.
Yeah.
And we have that time. It's just a question of
how. We do have that time, right?
Yep. We have the time. So, great girlfriends, that's something for us to think about. It's not that we don't have the time. It's where we are distributing the time. And if we were to offer that devotion into our health wealth, that deposit, then imagine how much lighter and heart happy we can be later in life, as well as our energy for today, true, because it's not long-term, it's a short-term benefit.
Yep.
Yeah.
My patients always tell me, gosh, I have so much energy now. And then guess what, too? Your joints will thank you, because those joints are not going to get arthritis as with the same degree. In the end, maybe if people get old enough, there's going to be some arthritis. But it's just like you say, I've got my genetics, this is the body I have, but then putting it into motion as long as possible with the best quality of life is exactly what you're doing now, and encouraging people to do. And I really appreciate you.
Mm-hmm. So my next question is for my 20-something who, they're eating on a budget, a really, really tight budget. And so, like you said, there are organ foods that are not, suggested foods for us to eat. What are some of the other foods to avoid if you are eating on a budget and you really want to start the consciousness, right? And make some really, get some good thoughts going and do better. Where can you start?
Yeah, what I really like, what I've noticed about many young people, including my own children, is they're adults, young adults. Actually adults. They will pay close attention to plant-based foods. They will avoid, red meat. And I know some people like red meat, but even if you went and had a piece of chicken and the chicken had the skin and, guilty as charged, then you're going to have to make a decision. Are you going to broil it, which would allow you to remove some of the fat? And then you would have a much healthier piece of meat. And obviously everybody understands that some aspects of the meat would have worse cholesterol. Some people like shrimp, and including yours truly. That I'm not going to say don't eat shrimp, but maybe you don't need to eat the shrimp deeply fried and battered and everything. And then also then maybe you can have it maybe a couple of times a month as opposed to, several times a week. At the end of the day, one of the points I'm making here is I don't want people to totally make themselves miserable because they've got, they can't have oil, they can't have, you can do things in moderation. Saute some meals that you enjoy. You will have to reduce things like eggs, especially the yolk of the egg, because that also is high in cholesterol. The good news is for people who like to enjoy their red wine, if you would, you can have a glass of red wine, and that's actually good as long as it doesn't pile on the calories, because that's the other side of
Yes.
red wine.
Yes. That's so
So,
good. And then what do you
yep.
accompany with the red wine? That's the other piece too.
Yes,
Red
of
wine.
course, exactly. I'd rather have white wine if you gotta have the red meat, because I don't think red wine necessarily needs red meat, but
Mm. Mm-hmm. Mm-hmm.
yeah.
That's good to hear. And then including the annual checkup and any specific questions we should be asking our healthcare provider when we go
Right.
in or
Absolutely. Very, very good point. So I think you should ask, what are your numbers? They should, and now with the way the electronic medical record is, you can get actually a copy of your result. So
Mhm.
you can keep track of it yourself to see what is it, how has it been over time? Because sometimes doctors just get triggered to say, okay, it's time for a medication. And one of the things that you want to do yourself is maybe act a little bit before that time to maybe postpone the medication. But there are some people who have to have a medication. And I think rather than run away from that, I think it's to understand what are the potential side effects of the medication. Everybody knows of statins, and some people do very well on statins. Other people have issues with muscle aches and so on. There are other new drugs that are available to us. So you kind of have to ask your providers that, okay, what are my options here? Usually when you have a blood cholesterol, whether or not you're getting a diet approach to it, for example, ask them, could I have access to a dietitian to work with me? And then that means you have somebody who's going to go through your list of foods that you prefer and see which ones you should significantly reduce and sometimes even get rid of, as I said. And then after about usually a minimum of 6 weeks, but more like 3 months, depending on what the number is, may need to be another follow-up just to see, is it going in the right direction? So you yourself can make a decision. Is this getting away from me? Do I need to have a drug? And then if you do need to have a drug, you ask the question about what's the best dose that I can avoid side effects, especially if I'm trying to keep up with my diet. What I don't like is when people think because I'm on a drug, I can let myself go. I can eat whatever I want. Because then all that winds up happening is you go in and they say, okay, it's still high. Well, we're going to increase your dose. I mean, it's like you sort of defeat the whole purpose of you being a collaborator
Yeah.
in your own health.
A collaborator. That's such a powerful word there. Yes. A collaborator in your own health. The doctor's job is not to fix, and the doctor's job is to help support it and help to create
Exactly.
a rhythm with you. That's so good.
Yep.
I love that. That's also helpful. Dr. Ofili, so, I know you've been doing this for a long time. I'd love to know, what will be your health wealth legacy?
Well, I actually think you started to say this, and we've talked about this throughout. I think my health wealth legacy is to say to myself and others who are willing to listen, um, at the end of the day, you have control of this.
Mm-hmm.
There are aspects of this that you don't control. How, the genetics of your family, when you go into the health system, how people engage you. That's where I think your self-advocacy becomes an active part of the legacy. And so we have to know what we've brought to the table. But I think we also have to be encouraged, because with whatever we have brought to the table, we have the capacity to make it much better, or to make it run, as you say, as long as it can, with a very good quality of life. I don't know if that's the answer to the question you asked about health, wealth, legacy. You mean my own legacy personally?
No, I hear it. Well, no, what I've
Okay.
gathered is that your advocacy. So
Yeah.
you're really passionate about ensuring that people are equipped to
Yeah.
make better health decisions, and you're committed to really giving people people the literacy that we need
Yep.
to, to be confident. And like you said, be collaborators, be powerful collaborators with our healthcare providers.
Yep. Just
Yes,
like you
I love
never
it.
expect anybody, you know your body better than anybody else. And
Hmm.
so your ability to know it enough so when you're in an encounter, you can say, this is what I know, but I'm willing to learn from you so I can do better with what I know I have. I think that's usually the best outcome. Unfortunately, sometimes the system expects you to just sit there and just receive stuff, which means you're very passive, and that means you're not going to be engaged because you really don't quite understand all of it.
Yeah, that's so true. That's so
Yeah,
true. And we start to feel afraid. And at that point, we start avoiding doctors because,
exactly.
yeah, it's intimidating. And then the wealth is lost at that point. it's,
Exactly.
it's
Exactly.
completely lost. Well,
Exactly.
I could keep you longer, but I know we've got to wrap. But Dr. Ofili, you've been amazing. And I want to especially thank Healthy Women
Great.
because these conversations are so important to our community. So special thanks to Healthy Women and Esperion Therapeutics as we start to learn and grow as better advocates and allies, to our journeys in health wealth and ensuring that, we can reduce high cholesterol in our families and even in our own health journey. So thank you very much for your advocacy, for your
Thank
wisdom,
you.
for your leadership, your contribution, and even the research that you do to continue to learn in your craft so you can be a better physician. It,
Thank
it is
you.
instrumental to all of us. So thank you so much for
Thank you,
being with
Sybil,
me
and keep
today.
up the great work. Really, really appreciate the work
Thank
you're doing
you.
as well. Thank you.
I intend to. Thank you
Mhm.
so much, Dr. Ofili. Have a great day.
You too. Bye bye.
Great girlfriends, did you enjoy this week's episode of the podcast? If so, would you please give us your amazing review on iTunes? Every single review helps another great girlfriend get plugged into the podcast, into the community. Speaking of community, make sure you join our Facebook group, The Great Girlfriends. You follow us on Instagram at The Great Girlfriends and on Twitter at _Great GFS. Last but not least, we'd like to thank my amazing husband, Kwaku, Sam and Dilly, and all of you for being a part of the global community that makes us so strong. Please remember to share with your friends, keep listening, and keep being a great girlfriend. I'm Sybil Amuti, and I'm out. Peace.